Thanks so much for the introduction. And we're so excited to launch and present the Women-Centred HIV Care Pocketbook, the new and improved and final. It's finally final, so we're so excited. And this talk is a part of the Women-Centred HIV Care Hub. And I'll let you know more about the Hub. And the Hub has actually 9 different sub-hubs, and we're partnering with WHAI today to carry out this Ontario sub-hub knowledge mobilization event on the Women-Centred HIV Care Pocketbook. And I will start, next slide, with a land acknowledgement. We acknowledge our presence on the traditional territories of many Indigenous nations, and we work to prioritize Indigenous women and gender diverse people's voices, leadership, and direction in our work. We recognize our shared responsibility to work in allyship towards reconciliation with the original stewards of these lands and are committed to fostering meaningful relationships with the communities with which we share this space. Through our projects, we sincerely endeavor to support and sustain multi-generational progress towards better health outcomes and for those living with HIV, and to eliminate identity as a barrier to comprehensive and accessible healthcare. We also want to acknowledge the painful history of slavery here in Canada and its contribution to the lingering effects of medical racism, as well as celebrate the strengths and determination of Black communities who fought and continue to fight for freedom, justice, and equality. And we're going to start with a poll question. What are you most interested in learning about today? So the poll is popping up right now. So what are you most interested in learning about today? The Women-Centred HIV Care model, or upcoming research regarding women-centered HIV care and health advocacy? We have some projects coming up that we'll share with you. Some of the unique health needs of women and gender diverse people living with HIV. Or are you interested in how I can support patient self-advocacy in clinical settings as a WHAI worker, more practical tools at the front line? So let us know, pick one of those. And I always love a poll, and like we need a drum roll to see what the answer is going to be. So, a pretty nice distribution. Less are interested in the women-centered HIV care model, and I'm thinking that that's because you've already seen it or heard about it, which I'm excited about if you have. And then about a third interested in upcoming research and talking about the unique health needs of women and gender diverse people with HIV, and also what you can do at the front line. So, okay, well, let's get started. That's what we're going to cover today. We're going to cover all of those. Next slide. I think we, as those working in this sector, we all know that women with HIV experience vast social inequities and can experience poor health outcomes compared to men with HIV. Those social inequities include gender power imbalances, stigmas, oppression, violence, and issues related to social determinants of health. We've all seen that amongst our clients, and we see it firsthand, and that's the work we do to narrow the gaps regarding those inequities. In Canada, women with HIV have been shown to have poor health outcomes to men with HIV. And so women with HIV have been shown to have poor linkage to care, use antiretroviral therapy less, have lower rates of viral suppression, have higher rates of depression, and higher rates of isolation, anxiety, and also high rates of violence and trauma. And most recently, we're just finishing up an analysis with the WCHC data, the Canadian HIV Women's Sexual and Reproductive Health Cohort study, showing how women with HIV in that study had actually unbelievable high rates of mortality. Not just that, but women with HIV have unique social and health concerns requiring complex care and requiring an important unique knowledge and skill and related to the care they should receive. And this includes medical care related to topics of HIV and aging issues like menopause or menstruation. There's also women's healthcare issues that are unique related to sexual and reproductive health needs, and also social needs that are unique, housing, food security, and many times women have caregiving responsibilities. Next slide. So that's actually where the Women HIV and Health Research Program comes in. I actually started this research program 19 years ago, really right out of where I'm sitting today, which is in my clinic, and listening to my patients, listening to my primarily women patients, at the time, cis women patients who were coming to see me and who were telling me about what the most important issues were in their lives. And so the Women HIV and Health Research Program came about with women living with HIV to develop research programs really that would address the most important issues that women in my clinic were saying that they wanted to deal with. So at first, it was the Women HIV Research Program, and now we've renamed it and rebranded the research program to the Women HIV and Health Research Program, and it aims to support research activities related to the field of women, and that includes cis and trans women and gender diverse people, HIV, and all of health and well-being, prioritizing leadership and partnership with women and trans and gender diverse people living with HIV through interdisciplinary community-based research. One of the largest projects that WCIP, which is what we call it in terms of as a short form, was supporting and running the Canadian HIV Women's Sexual and Reproductive Health Cohort Study, WCHC, which is Canada's largest longitudinal community-based research study that aimed to generate knowledge and close the gaps for women living with HIV in Canada. And one of the biggest outputs out of WCHC was the Women-Centred HIV Care model. And so here's the model on the left. I am going to walk you through that. And a couple of years ago, we actually received a grant from the Canadian Institutes of Health Research, CIHR, to launch the Women-Centred HIV Care Hub. So first, let me walk you through the model, which many of you already know about. The model is meant to say this is the care we believe women living with HIV, so that includes cis and trans women and two-spirit and gender diverse people, should be receiving this kind of care. It's in the shape of a house, assuming that most people think that a house is a safe place to go. And the foundation of the care should be that they're receiving trauma and violence aware care. The first floor is that they should be receiving person-centered care, and that's person-centered care with attention to social determinants of health as well as family. The second floor signifies that the care should be integrated. So not just they shouldn't be just receiving HIV care, but that HIV care should be integrated with women's health care with attention to sexual and reproductive health and rights. And that could include also gender affirming care. And that care should also be integrated with mental health care and substance use care, which is the third room there on the second floor. The roof is the beautiful yellow sun, showing how this care should include peer support, capacity building, and leadership. And you can see the woman is as large as the house as the most important component, and could be supported by a peer in holding up the peer support sun. And also the door entering into the house is that beautiful sun color, because the peer could actually be the one supporting the woman entering into care. And then in the pathway, this care should be adjusted and delivered across the life course of the woman. So that's the model, and Asha and Amy are going to go through it in more detail related to the pocketbook. And so related to this model, we've developed a hub. And if you're not a part of the hub yet, we would love for you to join. Really, what the hub is, the Women-Centred HIV Care Hub, is a national and virtual network. And so if this calls out to you, please email Amy at amy.ly@wchospital.ca to join the hub. And we're a network of people involved in the movement related to gender and HIV and sexually transmitted and bloodborne infections. And then we're interested in actively confronting misogyny, patriarchy, and the historical and ongoing colonialism. This network, or this hub, aims to promote knowledge dissemination and translation regarding the women-centered HIV care model to improve healthcare outcomes. We feel that by uniting diverse stakeholders in the field of women and gender diverse people, HIV and STBBI, our mission is to strengthen knowledge mobilization, drive system-level change, and advance gender-inclusive care, and empower the full potential of all individuals involved. Our overarching goal is to enhance healthcare outcomes, eliminate gaps, and improve the quality of healthcare for women and gender-diverse people with HIV and STBBIs. And you can see the overlap with the mission of WHAI. Again, one of the primary goals of the hub is to promote the uptake of the women-centered HIV care model. You can actually go to the Katie website or the hub's website, which is WCHC Hub.ca, and you could find links to webinars and YouTube videos presenting on the women-centered HIV care model. We've hosted community-based events like this one and others. And we actually have available also for free 3 digital toolkits that we developed in collaboration with the Center for Effective Practice to promote the uptake and to actually guide people on how to use the model in clinical settings. And there's a QR code there that you can scan if you want to download those toolkits. One is for care providers, and 2 of them are directly for women, one in English and one in French. However, we were told that the text was a bit heavy in these toolkits. You know, I'm quite detail oriented, so they're quite detailed and they're long. And so in response to that, and working closely with WHAI, We adapted these toolkits for a more approachable and patient-facing adaptation that is supposed to be able to be used as a patient-provider communication tool and a health self-advocacy tool, which is the Women-Centred HIV Care Pocketbook, which we're so excited to present to you. And I'm going to pass it on to Asha and Amy, who are going to present the Pocketbook to you.
Okay, so thank you so much, Mona, for that great introduction and centering us. This is my favorite part, talking about the Pocketbook, which was created with women living with HIV. So next slide, please. So the Pocketbook is a health and self-advocacy tool, especially created for women and gender diverse people living with HIV. The Pocketbook was meant to support communication between women and their providers in clinical settings. It's portable, it's colorful, it's easy to use, designed with accessibility and usability in mind. I love that it's only 40 pages and it's so small it can actually fit in your pocket. Next part was just about each section. So there's like 3 sections. So there's the key summaries. This is like a simple, concise explanation of core concepts. And you can find it everywhere that you see the icon. And then there's example phrases and questions. This is language people can use to express their needs. And you can find them anywhere where you see the message icons. And then reflective exercises. So this is prompts to help women think critically about their care and their care needs. And again, this is anywhere where you see the pencil. The intention of this is to give women living with HIV a practical and empowering tool that fosters confidence and navigates complex system care. So the Pocketbook contains 6 core sections, each linked to a key important part of the WCHC model. It also includes QR codes that connect users to trusted national resources for more in-depth support and information. Before we dive into the examples, let's take a closer look at the content of each section. You will see that the Pocketbook makes complex care concepts understandable and relatable. So the next few slides we'll go through each of the 6 sections. And next slide. So before we review section A, we want to ask, what are some ways in which the Pocketbook could be adapted to help patients facing intersecting barriers? And then thinking about a newcomer who is homeless and uses substances. What about someone with a disability who is facing multiple comorbidities like HIV, diabetes, hypertension, and requires multiple specialist care? Or an elder living in a rural area in Northern Ontario? Okay, go ahead and submit. Okay. Should we look at the results? Or maybe not. Okay. That's very interesting. A lot of people thought about the comorbidities. Um, that's really interesting point. I would also just say that technically the Pocketbook could help any and all of these 3 examples. I did want to ask if anyone wanted to talk on this. Nobody has to. If you wanted to, you can unmute. Okay, so that's totally okay. We can move on to the next section, and we'll definitely talk about this more in the scenario section. So, perfect. So the next part is the person-centered care. So this is one of the most important principles in the WCHC model. It's about really listening, understanding someone's story, their context, and their goals. Care that is person-centered recognizes each woman as an individual, especially within the context of social determinants of health. This section supports clients in initiating collaborative conversations with their providers that can help providers shift from a fixing to a partnering. Next slide. Okay, the next slide, section B addresses trauma and violence-aware care. We know that almost 80% of women living with HIV in Canada have experienced violence. That's staggering and has real consequences for health and healing. Trauma-aware care means creating safe, non-judgmental spaces, where healing is prioritized and re-traumatization is minimized. It also supports with understanding the pervasive nature of trauma, understanding its far-reaching impacts on lives, fostering trust. This section helps women name their boundaries, assert their needs, and work with providers to understand trauma's rippling effects. Importantly, it reminds us that healing is always possible and care must reflect that. Now I'll pass it to Amy to continue.
Okay, so the third section of the pocketbook is the HIV care. So this section really breaks down common terms and key knowledges around HIV care and retention. It's really important to know that women who are diagnosed with HIV can live a long and healthy lives, and your care providers should work with you to support you in achieving this. The pocketbook really outlines what HIV care can look like across the journey. So from the initial stages of counseling and starting medication to the ongoing ongoing care to support your health. It also includes information on how your provider can really assess your health history, tailor your medication plan, and take your concerns about any side effects that you are experiencing. As you can see in this slide, we also highlight U equals U, which stands for undetectable equals untransmissible, which means that if your viral load is undetectable, you can't pass your HIV on to others. And also, because tracking your health is super important, to the right of the slide, you can see the sections where you can note down key lab results, such as your viral load and your CD4. And there's also information around disclosure, including what your legal rights are when it comes to disclosing your status. Next slide. And within the HIV care section of the pocketbook, we also have this beautiful vaccine tracker. You can really use this to keep a record of all your shots, the dates when you did them, and if you're due for any other vaccines. And then we also have key phrases that you can use when talking to your healthcare provider regarding your medication or just any side effects that you're experiencing. The next section is the women's health care section. So this section really focuses on sexual and reproductive care and health rights. This area is often essential to women living with HIV, but it's also one of the sections that can be very challenging to talk about during clinical settings. So many women have reported that these conversations are very uncomfortable to them and that they have difficulty bringing this up to their providers. So that's why the pocketbook is here, and it also includes tools to help you navigate that situation. You'll find a lot of information on topics such as sex, sexuality, gender, menopause, breast, or chest feeding, all within the context of your rights and your choices. We also have practical prompts to really help you start these important conversations with your care provider, especially if you're unsure on how to bring this up when you have an appointment. The goal is to really help you self-advocate, express your needs, and making your voice heard when it comes to your sexual and reproductive health. The fifth section of the pocketbook is the mental and emotional health care. So we know that caring for your mental health is just as important as caring for your body or your physical health. And that's why the pocketbook includes practical tips and strategies. Things such as getting enough rest, taking walks in the nature, reaching out for support, or meditating. We also have a QR code that links to the Rainbow Health Ontario, which provides a list of mental health providers that you can show your care providers to get referral if needed. And of course, we also have prompts to really help you start with these uncomfortable conversations with your healthcare provider about your mental health. And last but not least, the final section of the pocketbook is the peer support, leadership, and capacity building. Peer support can play an important role in improving long-term health outcomes and overall well-being. Women should be aware of peer support and leadership and capacity opportunities and what are available to really help and strengthen their confidence and well-being. So peer support means connecting with others who've had similar experiences. It can be done on a one-on-one, in groups, in person, or online. The pocketbook also introduces the concept of peer navigators, which are trained individuals with lived experience who can help you guide others through the healthcare systems, offering referrals, education, and emotional support. The pocketbook also highlights that women have a right to be an active participant in their care, and if they choose to really take on a leadership role in really shaping HIV care program and research. So me and Asha walked through kind of briefly all the components of the pocketbook. So I'll pass it on to Mona to really walk us through how we can use this pocketbook in some real life scenarios and how it can be used in practice.
Okay, thanks so much, Asha and Amy. I don't know if there's any questions now, or we have a couple of scenarios to practice, and we can, if there's volunteers who want to practice with me, are there any volunteers, any questions? If not, Amy or Asha, do you want to practice with me? Can maybe one of you can do one and the other one can do the other. Is that okay?
Okay.
Yeah. Okay, so if you go to the next slide, we wanted to give some real scenarios, and one idea to do this practicing was to see. I think it's actually easier if what we'll do is I'm going to act as if I'm the WHAI coordinator, okay? And you have a client who is coming in and sharing a scenario with you where they're having difficulty with their clinician, or they're worried about communicating something with their clinician, and they're asking you for help. Okay, so Asha, you're going to be the 48-year-old menopausal woman.
Okay.
Doesn't fit exactly, but that's okay. You're a bit younger, but so here's the scenario. It's a 48-year-old woman in Hamilton has been dealing with hot flashes, insomnia, and intense mood swings. She books an appointment with her care provider, hoping to learn more about menopause and receive treatment. However, the doctor does not seem open to providing menopause care, and gives her very little advice on how to manage it further. So how could this woman approach this situation using the Women-Centred HIV Care Pocketbook? Okay, do you want to act at all, Asha, about your dissatisfaction with the clinician, or you want me to jump in on how to use the pocketbook?
You know, I like to act. So can you like really tell me what I'm supposed to be expecting when it comes to menopause? Because I think I'm starting to have symptoms of menopause. Can you like tell me how that affects me, especially as a woman living with HIV?
Yeah, and okay, well, I know a little bit about menopause. It's best for you to talk to your clinician about it. So your
Mhm.
doctor or nurse practitioner, nurse. There is also information online, but we have this new tool called the Women-Centred HIV Care Pocketbook that I think could help you. Should we walk through it together?
Yes, please.
Okay. Because maybe I could give you some advice of how you could go back into the doctor's office
Mm.
and advocate for yourself to get more information about menopause and the care you could get for menopause. How does that sound?
That sounds really great. Go ahead.
Okay, so this pocketbook is new. Right now it's in paper copy. We're hoping to make it into an app. Right now it's in this pocket copy. And when you open it up, we go over with the Women-Centered HIV Care model. And it says, this is the Women-Centered HIV Care model to guide your care, your way. And then there's some tools of how to use the pocketbook. And there's on page 3, it goes over some thoughts of how to get the most of your appointments. So like what you're doing right now is preparing before you go into your appointment, writing down your main concerns, websites you've gone to, information that you collected, questions that you have, so that you go into your appointment prepared. And when you're in with your appointment, it's good to go in with those notes. Okay, go prepared, and also be ready to write things down that your care provider is saying or that you want to go over. You also have the right to ask your care provider to slow down, like say, please, can you slow down what you're saying or explain differently so that you understand better. And then and also what you can do afterwards, because sometimes you go into your appointment and you have questions, but you don't remember them on the spot. But when you leave, write down what you think you forgot that you wanted to ask and make another appointment. This is my favorite part of the pocketbook, which is on page 5, which is about health self-advocacy. Have you heard that term before?
I have briefly, but I'm not 100% sure.
Okay, well, the idea is that you have the right to the best care possible. And sometimes the doctor or the nurse practitioner is busy, or they're tired, or and they might not be addressing the issue that's important for you. And so what do you say, or there's things that you can say to advocate for yourself, to have your health needs looked after. Do you see what I mean? So in the pocketbook, we give examples of phrases that you can use for standing up for yourself by simply sharing your thoughts, feelings, questions, and what your goals are and what you're hoping to get out of the visit. Okay. I can give you some examples. Is that a good idea?
Yeah, for sure.
So you can use the pocketbook for health self-advocacy. You can, for example, go into the doctor's and office and say, listen, at our last visit, I was really interested in menopause. I think I have menopause symptoms, but I didn't feel like you fully addressed the issue. Can we go over it again? There's this new tool that came out, the Women-Centered HIV Care Pocketbook. Have you seen it? If not, I'd like to go over it with you. And on page 34 of the pocketbook, there's a whole section on menopause. And I do think that I have some menopause symptoms. Can we go over this page together? And oh, look, at the bottom, there's a link. At Katie, there's actually a whole book on menopause that that can be linked to from the pocketbook. It's called Menopause and You. And it has some details about what is menopause, what the symptoms are. And see, I have many of these symptoms. I'm feeling irritable and tired. I'm having hot flashes. I'm having some vaginal dryness and joint pains. So I really do think that I have menopause. And in this tool and in the pocketbook, it says that there's possible medication that could be used. I see that there's lifestyle changes that I can do. I can dress with layers, drinking cold drinks, meditating, exercising, reducing alcohol and quitting smoking, and using lubricants during sexual activity. And I've started all of those, but I really do think that I'd like to consider medication. And then if the doctor says that that they don't know a lot about starting medication, you can always say, well, one phrase that I really like to recommend using for health self-advocacy is if the doctor or the nurse practitioner is dismissing you, consider using the phrase, this is really important to me. So really stressing that, listen, this is really important to me. I don't feel like you're understanding how important this is to me. Do you think you could use that phrase?
I think so. And I think it's really important because I live in Hamilton, right? So, and I live a little bit outside of Hamilton. So when I go see my doctor, I really want to get the information right away. I don't want to keep going back and forth.
Yeah, that's a good point, because and who knows when you're going to get your next appointment, could be months away.
Yeah.
Good to get the most out of your appointment. So, and that's also why it's good to mark down notes and
Mhm.
mark down what are the most important issues for you for this appointment. And if they're not being addressed, have phrases like, listen, this issue, I don't feel it has been fully dealt with, and it's really important to me. Can we go over it some
Mhm.
more? And then you also have the right for a referral. If your specific doctor doesn't know how to deal with that issue. So for example, menopause, you can say, could I get a referral to a gynecologist or to a menopause specialist in the area? And then they could refer you if they don't feel comfortable um, with that topic. Were you able to ask for that at your last visit?
No, oftentimes I feel like I'm not supposed to, and I worry a little bit sometimes of like making my doctor angry. Um, but I learned a lot from just sitting with you because I learned that like I have the right to ask these things because when I think about my culture, most of the time the doctor is always right. But now I learned that like here in Canada, you can advocate and you should for your health rights. So I think that's very interesting. I'm definitely going to bring these things up to my doctor.
Yeah, I do recommend it is helpful to stay calm and be polite, but be firm and strong in terms of what you want and what's important to you. So to use phrases like, well, thank you for your expertise. However, I don't feel like you're addressing what's really important to me today. And these symptoms are really important to me. Could you send a referral if you don't feel like you have the knowledge on this topic? And just to let you know a little bit more that in the field of menopause, approximately like a decade ago, it became unpopular to prescribe at the time it was called hormone replacement therapy. So now it's called menopause hormone therapy. So in the pocketbook, we kind of merged both so that everybody knows what it is, as a menopause hormone replacement therapy. But it was unpopular for doctors and nurse practitioners to prescribe menopause hormone therapy about a decade ago because of a study that was released called the Nurses' Health Study. But they reanalyzed that study about 5 years ago, showing that that actually for younger women around 50, that it's actually quite safe and beneficial to start menopause hormone therapy. So sometimes it's helpful knowing that knowledge and going into the doctor and saying, I know that a decade ago, it may have been unpopular to prescribe menopause hormone therapy, but there's been new analysis showing that it's safe and beneficial for women of my age. Can we look into that together?
Mm.
And exactly like you said, that the other thing that we encourage in the pocketbook is shared care decision making, because really it's your health. So it's about you working with your care providers to get the care you want and for you to be healthy and well. Does that resonate with you?
Yeah. Can I have that pocketbook, please?
Yeah. I see a bunch of comments in the chat. Thank you so much, Asha.
No problem.
I hope that was helpful for everybody. Yeah, so we hope to do an app. However, the feedback from WHAI, which I think was a really good one, was to start with a paper version, just because we can't assume that everybody has a smartphone or is computer savvy and literate. So having actual paper version makes the pocketbook accessible for everybody. And now that it's finalized, we are going to start working on an app. What are other questions? Yes, we are very excited that we will be also partnering with Katie, who will be translating the pocketbook into French, and also handling the first set of printing so that it could be ordered from the Katie ordering center. And absolutely could even be translated into other languages. Any other questions or comments about the case or the use of the pocketbook before we go into the second practice example? Okay, Amy, are you good with being the actor for the second case?
You can try. I won't be as good as Asha. I can't promise you that, but I can try.
Okay, next slide. Okay, so again, I'm going to, or do you want to be the Y worker, Amy, or you want me to act as the Y worker?
You can be the Y worker, Mona. I'll be the patient.
Okay.
Yeah, I can just read it as if it's me.
Okay, you go ahead. You
Okay.
read it, and
Okay.
I'll act as the Y worker.
Okay, so a little background about myself. I'm 27 years old and I'm a trans woman and I live in Ontario. I'm seeking out for gender affirming surgery, but I'm unsure on how to voice this need in my appointment. Some of my friends and peers have told me something about health self-advocacy, but I'm not really sure about what this term is and how that applies to me. And I really need this surgery and I don't know how to bring it up to my doctor when I have my appointment next week.
Well, thank you. Thanks for sharing all that with me. And that must be a hard situation that you're in. Many times gender affirming surgery and care is life-saving. It's essential for people to feel like themselves and for their mental health. So I'm so happy you came and you shared with me. Actually, we actually received a tool this week that I think you could use to help in your situation. Is it okay if I go over it with you?
Yeah, of course, that'd be great.
Okay, it's called the Women-Centred HIV Care Pocketbook. Here it is. Isn't it cute?
Yes, love it.
And exactly like you say, that health self-advocacy is important. This pocketbook actually goes over that, and it can be used as a patient provider communication tool. So you could bring it into your visit. Do you think you'd consider doing that?
Yeah, of course. But during my appointment, sometimes I only have 10, 15 minutes. But what
Okay.
is the best way to do that in that short period?
Okay, so you can have a look at some of the details in the pocketbook. But on page 3, it is actually a page where it goes over getting the most out of your appointment. So if you only have 10 minutes, it's really important to be prepared. So write down what you're going to say, write down what's important to you, write down what your goal is, and prepare before you go in. Okay. Be ready during the appointment to also take notes. And then and also think about, it's good after an appointment to even to debrief with somebody about how you thought it went. Did you get your needs met? And so that's reviewed on the 3rd page of the pocketbook. On the 5th page, it describes health self-advocacy, which is what you're talking about, which means really standing up for the health care that you want. Yeah, and you have the right to be a partner in your care and to get the care that you want. In fact, gender identity and gender expression has been added to the Human Rights Act in Canada as of 2017. So it's your right, actually, to have this kind of care and surgery. Did you know that?
No, I didn't.
Mm-hmm. There are some examples of phrases you could use for some health self-advocacy. So you could ask the care provider to slow down in their talking, or say, I don't understand. Can you explain that again? A little slower in plain language. Why is that test important? You also have the right to a second opinion. And you have the right to take time to consider your options. And you also have the right to bring in somebody else. So if you feel like you're too nervous to talk to the doctor, consider bringing somebody else with you so that it's not just health self-advocacy, but you have somebody advocating with you. That often helps. Have you thought of doing that?
Yeah, I'll bring one of my peers who brought up health self-advocacy to me. Maybe she'll help me to really in my appointments.
And then for your specific topic and healthcare need, it is there in the pocketbook. I'm going to go right to the spot, since you say you might only have 10 minutes. So all the other parts of the pocketbook that we went over, that's really for you and for you to prepare for your appointment. Okay. Um, On page 35 of the pocketbook, it gives you a phrase that you can use. So you could go into your doctor's appointment and you could say, I'm interested in gender affirming care. Actually, I'm interested in gender affirming surgery and in transitioning. Can you help me with that? Do you know about the excellent Rainbow Health Ontario guidelines? And there's a QR code to the Rainbow Health Ontario guidelines. And in fact, I recommend you even go to that website, and there's tools on that website of things that you can learn about and phrases you can use with your doctor. And so if your doctor says, well, no, I don't know about the Rainbow Health Ontario guidelines, then you could say, well, can we go over them together so that we can, you can support me in referring me for surgery. And then if they say, well, I don't know how to do that, then it's important for you can ask, well, can you refer me to somebody who would know more and know how to do that? Do you think you could do that?
Yeah, most definitely. This is so helpful. I think it's important that in order to advocate for myself in an appointment, it's also good to have some knowledge on what I'm looking for and also the guidelines. And I love how the next page is a page of just notes. So while reading the guidelines, it'll be really helpful to just jot down some key points that I'm going to bring to my appointment next week.
Yeah, so through the pocketbook, there's a couple of pages just blank with lines for you to be able to write notes. Exactly. And but of course you can always bring your own notebook to write things down. But just to give you a little bit more information in terms of referring for gender affirming surgery, there's actually a form that needs to be filled out and submitted to the province for approval of that surgery. So not all physicians can actually sign that form. So the person has to have been the doctor or the nurse practitioner has to have been trained following the W-PATH, which is the World Providers for Trans Health guidelines. And actually Rainbow Health Ontario has a course that physicians can take to be one of the providers who can fill in the application form to the province. So you can download that form, and you could even print the form and bring it to your doctor. So that form has, so you just put in Ontario gender affirming surgery application form. And what you'll see is there for bottom surgery. And so that usually consists of what we call a vaginoplasty. It actually includes two care providers, two either doctors or nurse practitioners, or actually, no, the first signator has to be a doctor or a nurse practitioner. The second one can be a doctor, nurse practitioner, social worker, or a psychologist. So, but they have to have done the training. And then you'll also see there's requirements whereby the person has to have lived in their gender for over 12 months, be on gender affirming hormone therapy for at least 12 months, or have a contraindication not to take them. And the doctor or nurse practitioner has to be trained in filling in the forms. And so the first person signs it, and then the second person also needs to sign it. For top surgery, only one signator is needed. So that's just to give you a little bit of knowledge. And but you can print out that form and take it in to the doctor's office with you, saying that this is what's needed. And then after that approval comes in, then that's when the referral goes to the surgery center. In Ontario now, there's 2 surgery centers, one at Women's College Hospital, and there's a new one in Ottawa that you may not have known about.
Hey, amazing.
So I
Thank you
hope
so much.
that's helpful. Not sure if you have any more questions or if you feel prepared.
No, I don't have any more questions. I'm really going to take a look at the guidelines and go through the pocketbook to really make sure I get everything I need from my appointment. Thanks, Mona.
Okay, thanks so much, Amy, for doing the case with me. I hope going over that practicing and how you could use the pocketbook with your clients is helpful. Next slide. Another poll. Can you think of any other situations in which the Women-Centred HIV Care pocketbook could be helpful in navigating a conversation? Substance use management and care, concerns not being taken seriously, healthy aging with HIV. So I will tell you, we had like a little pilot of the pocketbook, and we were missing a substance use section. So that is what's been, so if you have one of the older versions, it doesn't have the substance use section, and the newer version that is going to be emailed to you has 3 pages. So we'll send that out to you. We hope that health self-advocacy, we've gone over that with the 2 cases. There's a couple of pages about aging, plus the extra page on menopause. So we'll see what the poll says. I think a lot of these questions, it could be, you could answer all of them. Okay, great. So 2/3 said substance use management and care. I'm really excited to get from you about our substance use section that's been added. You know, I hope that the pocketbook gives you some tools of how to work with your clients to encourage health self-advocacy, and of course, healthy aging with HIV. And so in this next section, which isn't going to be too long, and then we can open up for some questions, we're going to talk to you about some upcoming research projects that we're going to be doing with the pocketbook, and also how you could get involved as a WHAI worker. So we're really excited that we received OHTN, Ontario HIV Treatment Network funding to roll out this implementation package using the pocketbook. And so we're calling it W-CIP, and it is a women-centered HIV care clinic implementation package. And it centers around integrating the use of the pocketbook into clinical care settings, and also combining that with peer-supported and community-backed workshops and a pilot launch. So what you can see on the right, this is the package, the Women-Centered HIV Care Clinic Implementation Package, which has 2 components. So the idea is, and we have 7 clinics in 4 cities that have agreed to participate in this study, implementation science study. So the first part of the implementation package is actually doing training with all the clinic staff about the Women-Centered HIV Care model. So we're asking the clinics for all their staff to be trained about, for example, the importance of trauma and violence-aware care. Especially, or including everybody, the front desk person is so important. That's the first person that sees the patient who comes in and what their disposition is, can mean that that person either stays for their clinic appointment or turns around and walks out. So doing that training with all the staff, we feel is really important. We think it would take about 1.5 to 2 hours. We're also offering to the clinics that we can train 1 to 2 of their nurses to do cervical cancer screening and breast screening, so that we believe in task optimization, sometimes known as task shifting. But if nurses can do some of that care, that will ensure that people with cervices and breasts can get full care. So that's the training of this. That's the clinic component. And then we're going to be asking clinic staff to hand out a postcard with the pocketbook, and their clinic patients could sign up for the second part, which is a community peer-led workshop, which is peer facilitators will be work in collaboration with the local community-based organizations to run 2-part workshops on how to use the pocketbook. And so those will be they can be in person. We might run some virtually. And so that's the whole package. So the package is women-centered HIV care training for the clinic, but also women can sign up for a 2-part peer facilitated workshop on how to use the pocketbook. So it'd be I look forward to hearing what you think of the study design, or if you think it's a good idea. We're hoping it's going to roll out well. So far, so good. But what will happen, again, we're going to be doing training. We'll have to hire peer facilitators in the cities and do the training of the peer facilitators. So training the peer facilitators on how to do the workshops of teaching women how to use the pocketbook. We'll also be doing the training of the clinic staff. And then we will be launching across 4 cities. So right now that includes Toronto, Hamilton, London, and Windsor. And as because it is research, we will be having surveys done, for example, evaluations, like how was the training? How did the training go? Did you learn different aspects? Did you learn anything new? Will you be implementing it into your practice? And as well as some sort of more detailed one-on-one interviews about the tools and the implementation. And the women who sign up for the workshops will be doing surveys before and after being trained how to use the pocketbook. And then we're also aiming to develop some supplementary tools as part of this project, including a mobile app. So for example, as already has been discussed in the chat, a curriculum with more detail about the different sections in the pocketbook, like an e-module learning program, and even potentially a facilitator guide, so train the trainer, where even people in other provinces or countries could actually use this model to roll out their own peer facilitator workshops. Next slide. How can you get involved as a WHAI worker if you're interested in W-CIP? So another poll question. What do you think is the biggest barrier to women using tools like the Women-Centred HIV Care Pocketbook? Do you think it's lack of awareness, stigma or privacy concerns, time constraints during appointments, low confidence or health literacy, or other? And we'd love to hear your thoughts. This is a good list. I'm interested to see what you think is the biggest barrier to women using tools like the Women-Centred HIV Care Pocketbook. One thing that we did do is you'll see that on the front, it doesn't say HIV anywhere, so that if the pocketbook is out, it does somebody won't know it's related to HIV. Okay. Oh, interesting. Really, really evenly split between lack of awareness. I think there's lack of awareness in for people in Canada that they have to advocate for their own health, that we don't have a healthcare system where it's guaranteed that your care provider is doing everything that they can for prevention, for example, that you really have to be responsible for your own health, and that all the right tests and everything are being done. Stigma and privacy concerns. Yeah, I would have thought that one would be higher. So interesting that it's not higher, but still about half. Time constraints during appointments, that's come up to be a big issue, and low confidence or health literacy. So the idea of these peer facilitated workshops is really to teach about health and healthcare literacy. Next slide. So let us know if you're interested in being involved as as a WHAI worker. And this is what we have spoken about with the WHAI leadership that we can make available to you. There will be postings for the peer facilitators in those cities that we spoke about: Windsor, London, Hamilton, and Toronto. So that will be available. So you can think of even clients that might fit the role of as a peer facilitator. And we will be doing the peer facilitator training. So training the peer facilitators on how they are going to teach women on how to use the pocketbook. And what we're offering is that since we're doing that training, we would open that training to WHAI workers to join the training that we would do for the W-CIP peer facilitators. So when that training is available, it'll probably be like a 4-hour training, like a half a day, morning or afternoon, or where we are training our peer facilitators on how to teach women how to use the pocketbook, and we're opening that training to all the WHAI workers. So you can join us, and that's probably going to be hosted. I know it says late 2025, but it's probably going to be hosted in 2026. So if you're interested, let us know, but we'll also reach out to the WHAI leadership to let you know, and even ask when you think the best time for that training is, and we might even have to do it more than once. So keep an eye out for that. Please advocate for the use of the pocketbook when it becomes available through Katie. Please order it. Let organizations and women know about it, and place the pocketbook in accessible spaces. Help your clients navigate its use. We've tried to make it as simple to use and as possible, but sometimes supporting clients on how to use it for in different circumstances, especially, will be important. And provide us with feedback if there's already feedback that we've received from you. It sounds like you do think proceeding with an app is an important next step. We do also, and we might even reach out to you to ask for feedback on the piloting of the app, the usability of the app. Let us know how you feel it's going in terms of sharing it, and if it's really easy to use, and explain what the strengths and the weaknesses are of it. Are there any parts that are more or less useful? How easy is it to navigate? And also, how is the use changing over time? Again, you can scan the QR code. I think it takes you to our website. Let me see. Yeah, it takes you to our website, which I also put into the chat. And so you can, through our website, you can know how you can connect with us. We also have Women-Centred HIV Care Hub talks on 2 Wednesdays of every month. So you can also keep an eye out for those. And we have actually those talks available on our YouTube channel. And so you can reach out to Amy if you want to be more involved in the hub. There's our website again, and you can find us on social media. And a big shout out to Sia, who is our Women-Centred HIV Care Hub student, who has helped us with our website and social media and these slides, and has done a great job. Thank you so much, Sia. And thank you to Amy and Asha. And next slide. And a special thank you to WHAI. It's been amazing partnering with WHAI for the development of this pocketbook. Really important feedback on usability. And thank you for allowing us the opportunity to spotlight our projects and our work. And we look forward to our continued collaboration together. And we do have a evaluation. So we're going to put the evaluation in the chat. So please fill out the evaluation. It's important to us. We actually need it for our reporting back to CIHR. And Ashley, are we going to stop the recording for the question period? Yeah. Okay. So we've reached the end, and we're going to stop the recording, and we can open it up. We have about 15 minutes for questions. Thank you so much.